Thank you, Dr. Francis, for the comprehensive lecture. We will wind up the plenary session without discussion. And once again, I would like to thank all four speakers, Dr. Naushad Ali, Dr. Upul Wickramarajchi, Dr. Ruwan Munasinghe, and Dr. Rajivan Francis on behalf of Sri Lanka College of Cardiology. Thank you.
Thank you. I am inviting all the speakers to collect the token of appreciation on behalf of Sri Lanka College of Cardiology. Dr. Naushad Ali. Dr. Upul Wickramarajchi. Dr. Ruwan Munasinghe. Dr. Rajivan Francis. Thank you, Dr. Sundaresan and Dr. Nadija Senavaratna, to chair the session. Then we will move to the final program, the quiz. I want to remind you to fill the feedback form is inside the bag, and please hand over to us at the end of the program in the entrance. Now we are going to display the QR code for the quiz, and also we are giving some printouts of the QR code. Please kindly scan the QR code and enter your details, and after that we will start into the quiz. Thank you.
Now we have come to the final item of the program. Please kind enough to scan the QR code. Then you have to enter your name. After scanning the code, there will be a space for that. If you enter the name only eligible for the gift, we will give a gift at the end for winners. Now you can scan the code. Better to scan quickly. Only 22 scan. Enter the name also. Hurry up. Do you want some more time to scan? Yeah, carry on. quickly scan. We are already behind the time schedule. We'll give another 1 minute to scan. Hurry up. Otherwise, you won't be eligible for the gift. Okay, now we are going to the quiz. Just start it. Yeah, question number 1, I will read out. A 24-year-old nursing student presented with shortness of breath and central chest pain following a breakup with her boyfriend. On examination, she was tachycardic and tachypneic. Bilateral lung fields are full of crepitations. Saturation was 85% on air. ECG showed sinus tachycardia with mild ST elevations in V1 to V6. Troponin I was slightly elevated. 2D echo showed impaired LV systolic functions, ejection fraction around 40% with left ventricular apical ballooning. BNP was high. What's your diagnosis? A. Acute anterior MI. B. Pulmonary embolism. C. Acute heart failure. D. Poisoning. E. Takotsubo cardiomyopathy. Now you can vote. Look at the device and pick the answer and send it. Yes, the correct answer is Takotsubo cardiomyopathy. Okay, next question. Following medicines should be considered in all heart failure patients with reduced ejection fraction except A. Bisoprolol, B. Ramipril, C. Spironolactone, D. Empagliflozin, D. digoxin. You can vote it. Fastest one will get the more marks. Yeah, the answer is digoxin. Next, please. Question 3. Please indicate the incorrect statement. Venous congestion and organ hypoperfusion is the main mechanism of liver and renal injury in acute heart failure. Response B. A patient with heart failure, a development of confusion may indicate the possibility of liver failure. C. High-dose loop diuretics may cause acute renal injury in patients who receive treatment for chronic heart failure. D. A patient with acute heart failure who had primary PCI may have higher risk of having acute kidney injury during the post-procedure period. E. Tolvaptan is a novel drug that we use to treat hyperkalemia in patients who are treated for heart failure. Now you can pause. Yeah, the answer is E. Next one, please. Question number 4. Which is false regarding heart failure rehabilitation? A. Supervised individualized exercise training is a major component. B. Has multidisciplinary involvement. C. It takes place only in cardiac ward setup. D. Initial assessment of the patient is paramount. E. Should be centered around the patient and the family. Now you can vote. Be faster if you want to get the gift. Yeah, good. The answer is C. Next one, please. The question 5. Which of following is true regarding coronary artery disease? A. It is the main reason for hospital morbidity. B. Age is a modifiable risk factor. C. Is disruption of plaque can lead to thrombus formation. D. Acute coronary syndrome is usually present at right chest pain. E. Diabetes is a non-modifiable risk factor. Now you can vote. Should be fast. Yeah, good. The answer is C. Now I think we can see the race up to now. You can see. Be faster then. So we'll move to the next one. Question number 6. Best way of treating a ST elevation myocardial infarction. A. Emergency contact to the cardiology service for primary PCI. B. Thrombolysis with streptokinase. C. Thrombolysis with tenecteplase. D. Enoxaparin for 48 to 72 hours. E. Loading with dual antiplatelets. Now you can pause. Yes, the answer is A. Next question, please. Question 7. Which of the following parameters does not require routine monitoring to detect complications of acute coronary syndrome? A. Blood pressure. B. Continuous ECG monitoring. C. Heart rate. D. Pupillary size. E. Presence or absence of further chest pain. Now you can vote. Yeah, the answer is pupillary size. Next question, please. Question number 8. Which of the following is the correct statement? Most of the left ventricular thrombus can be detected by transthoracic echo. B. Neurological observation is not useful after PCI. C. 25% reduction in recurrent myocardial infarction can be achieved with cardiac rehabilitation. D. Statin is not important if blood cholesterol is within normal value in post-myocardial infarction patients. E. Diet with fat should be totally avoided. Now you can vote. Yeah, good. The answer is C. Next question, please. Question number 9. 58 years old male presented to ward with chest pain and suddenly collapsed. Cardiac monitor shows following rhythm. What is the best immediate option in the management of this patient? A. Give a phone call to the on-call doctor. B. Check blood sugar level. C. Direct cardiac shock, direct current shock, DC shock. D. IV adrenaline. E. TPM. Now what? Now you can vote. Be faster. The correct answer is C. Next question, please. Question number 10. Which of the following is not an immediate cause for cardiac arrest? A. Hypoxia. B. Hypovolemia. C. Hypoglycemia. D. Thrombosis. E. Toxins. Correct answer is hypoglycemia. Now we can see the winners up to now. Okay, next question please. Question number 11. What is the best prophylactic strategy for preventing contrast-induced nephropathy during cardiac catheterization? A. Stopping metformin 48 hours prior to procedure in all patients. B. Using non-ionic isosmolar contrast in liberal amounts. C. Intravenous N-acetylcysteine before and after the procedure. D. Adequate hydration with isotonic saline before and after the procedure. E. Hemodialysis immediately after the cardiac catheterization for all moderate risk patients. Time to vote. Now you can vote. The answer is D. Next question please. Question number 12. What anticoagulant should be given to the patient with metallic mitral valve? A. Heparin. B. Rivaroxaban. C. Warfarin. E. Enoxaparin. E. Dabigatran. Now you can vote. Good. Excellent. The answer is warfarin. Next question, please. Question number 13. Warfarin is indicated over direct oral anticoagulants in which of the following condition? A. Atrial fibrillation. B. Treatment of deep vein thrombosis. C. Pulmonary embolism. D. DVT prophylaxis. E. Mechanical or metallic valve. Now you can vote. The yes, answer is E, mechanical valve. Next question, please. Question number 14. A 52-year-old woman with a history of severe mitral stenosis and atrial fibrillation presents to the outpatient clinic with INR value of 12.5. She has recent history of melena. Her hemoglobin is 7.8 grams per deciliter. What is your recommendation? A. Reduce warfarin dose and no other intervention needed. B. Stop warfarin and repeat INR in 1 week. C. Stop warfarin 1 day and no other intervention needed. D. No need of admission. Withhold warfarin and give vitamin K 2.5 to 5 milligram orally. E. Need admission. Withhold warfarin, administer IV vitamin K 10 milligram and FFP. Now you can vote. Good. The answer is E. Next question, please. I think it's the last question. Question number 15. Failure in the health system result in unsafe transfer of a patient include. This should be corrected. I think failure in the health system result in unsafe transfer of a patient does not include A. Ineffective communication, B. Lack of adequate medications, C. Non-functional equipment, D. Inadequate training of the transfer team, E. Deterioration of the patient's disease condition. Question stem must be corrected. Failure in the health system result in unsafe transfer of a patient does not include. Now you can vote. Okay, good. The deterioration of patient's disease condition, the last answer. Now, it's the end of the quiz. Now we can see the winners. May I know the second? We will give 3 gifts, first, second and third places. Yeah. So, Lakshman Madhuranga is the first, Nipuna Rusiru is the second, and Madhusha Manav, I think name is shortened. So, these 3 will get the gift. In due course from the College of Cardiology, you will receive the gift. Thank you for the participation. That's the end of the quiz.